Hello, you will not believe, but diabetes affects 1 in every 400 children and is increasing at an alarming rate. If you're worried whether your child might be one of them, stay tuned to gain expert insights into early warning signs of diabetes in children, signs that parents should not overlook. But first, what is diabetes? Diabetes is a disease in which the level of your blood sugar or glucose is too high. If high blood sugar is left untreated, serious life-threatening problems can arise. Glucose comes from the carbohydrate or sugar present in the food that we eat daily, such as dairy, grains, vegetables, chocolate, drinks, and other sources. Our bodies use this sugar to provide energy to our cells, tissues, and organs. Extra sugar is stored in our liver and muscles for later use. The sugar in our bloodstream is regulated and delivered to our cells with the help of insulin, a hormone which is secreted by the pancreas. Now, there are two kinds of diabetes. One is when the pancreas is unable to make insulin. We call this type 1 diabetes. And the other is when the pancreas still produces insulin, but the body does not respond to it normally. We call this type 2 diabetes. And then eventually the glucose level goes up. Now, are you thinking which type of diabetes can the children develop? Well, type 1 diabetes most often occurs in children. And sadly, type 2 diabetes is now becoming more common in children and teens due to increased obesity among the young. Now, the exact cause of type 1 diabetes is unknown. But in most children with type 1 diabetes, the body's immune system, which normally fights harmful bacteria and viruses, mistakenly destroys insulin-producing cells in the pancreas. Once these cells of the pancreas are destroyed, the child produces little or no insulin. There are certain reasons found that can increase your child's risk of developing type 1 diabetes. For example, family history. Anyone with a parent or sibling with type 1 diabetes has a slightly increased risk of developing the condition. Genetics. Certain genes indicate an increased risk of type 1 diabetes. Certain viruses exposure may trigger the autoimmune destruction of the islet cells or the cells of the pancreas. Now, type 1 diabetes can affect the major organs in the body, and if untreated can increase the risk of developing certain diseases in the heart and blood vessels. It can lead to conditions such as narrowed blood vessels, high blood pressure, heart disease, and stroke later in life. It can cause nerve damage. It can injure the wall of tiny blood vessels that nourish your child's nerves. This can lead to tingling, numbness, burning, or pain. Nerve damage usually happens gradually over a long period of time. Diabetes can damage the numerous tiny blood vessels in the kidneys as well that filter waste from your child's blood. Diabetes can also damage the blood vessel of the eye's retina, which may lead to vision problems. Diabetes sadly also decreases bone mineral density, increasing the child's risk of developing osteoporosis as an adult. I'll share with you 10 signs that you as parents should keep an eye out for to keep the kids healthy. Number 1, using the bathroom a lot. If the kids find themselves going to the bathroom a bunch, especially at night, or wet their bed in sleep, it's something to pay attention to. Number 2, feeling super tired. If they're moving slower than usual or feeling extra sleepy, it's a sign to keep an eye on. Number 3, drinking tons of water. If they're always super thirsty and drinking lots of water, take a note of that. Number 4, losing weight without trying. If they're getting thinner without trying, it's something to be aware of. Number 5, getting sick more often, especially if they are developing frequent infections. Important to check it out. Number 6, wounds taking long time to heal. If their wounds take extra long time to heal, Number 7, skin changing colors. If their skin looks different, especially a dark patch or a band of velvety skin on the back of their neck, armpit, groin, or elsewhere, it's something to have checked out. Number 8, breath smelling fruity. If their breath smells like fruits, that's a sign too. Number 9, fingers and toes feeling funny. If their fingers or toes feel tingly or funny, it's something to be worried about. Number 10 is eyes not seeing clearly. If things look blurry, it's important to discuss it with your pediatrician. Now, if you notice any of these warning signs, seek urgent medical advice, especially if there's a family history of diabetes. Although there is no cure for diabetes, with treatment and consistent care, your little one can go to have a normal life and they can still enjoy that piece of cake on their birthday.